Welcome back. Today we're going to be looking at the pharmacology of the quinolones, and we'll be walking through with this outline the history, the classification, the mechanism of action, the resistance, the uses, the adverse effects, and the drug interaction. Quinolone happens to be a family of drugs which we consider as antibiotics. So when you have quinolones, you think of the family of the antibiotics. So for the history, the first quinolone to be discovered was nalidixic acid. Nalidixic acid in 1962 when it was used for the treatment of UCI, urinary tract infection. Now, actually, George Lesher, who was the one that has been noted for this particular discovery, and his co-workers wanted to isolate chloroquine, and in that they now discovered this particular drug. So please remember that nalidixic acid as the first in 1962 for the treatment of UTI by George Washer and his co-workers on an attempt to isolate chloroquine. Now, what have been the classification? It has been classified. Now, there are two classifications. Number one classification has been that those quinolones that do not have fluorine, we call them the non-fluoroquinolones. Now, for this one, only one example is there, nalidixic acid, while the other example happens to be those that have the fluorine group. We call them the fluoroquinolones, and this happens to be all others. Okay, so it's quite important you know nalidixic acid, even the sinoxamine and the likes of what this was the first way it was first classified. Now, but what is another way I want you to note is the one that we classify based on first generation, second generation, yes, third generation, okay, and then fourth generation. Now, how do we come about with this? For first generation, we have that they have action against gram negative, but not pseudomonas. All right. Now, for second here, it has action against gram negative and gram positive, some gram positive, but remember gram negative including pseudomonas. Now, for here, the third generation are those that have all things that we see in the second, plus actions that are going to be seen in atypical bacteria. And then the fourth one, all that we see in the third, plus anaerobic species. Correct? Anaerobic species. All right. So that's what I want us to appreciate. Now, what examples here? One example here, nalidixic acid. Nalidixic acid, sinoxamine. Example for the second generation here, we have corn. You remember with corn. Ciprofloxacin, ofloxacin, norfloxacin. Now, for the third generation here, we have the sparfloxacin, we have the gatifloxacin. I think there's a gati here, there is a gemi here, gemifloxacin. There is a spa here, there is a sitafloxacin. Okay. Here also we have our lemafloxacin. All right, I think the tusufloxacin. Here we even have the moxifloxacin. Then the thruvafloxacin. The list keeps going on and on. Now, MCQ question, first one I want to outline. This gatifloxacin and thruvafloxacin were withdrawn. They have been withdrawn. Okay, no longer in use, withdrawn. Now, another thing I'm going to add is that there is a fifth generation that there is a drug which is still in phase 2. Although it has not been published, it's still in phase 2. We call that one datifloxacin. It is going to be the future fifth generation. Datifloxacin, it is a phase 2 drug. All right, so history. George Lesher, 1962, on account of isolating chloroquine, discovered nalidixic acid, which was eventually used for UTI. Classification. We can classify it on the basis of those that have chlorine and those that do not have chlorine. While we can also classify on the spectrum in which they have actions against. Gram negative but not pseudomonas, gram negative and gram positive but with pseudomonas. All what we see in second generation plus the typical bacteria, all what we see in third generation plus anaerobic species, and the examples are there for us to look at. Now let's look at the mechanism of action of the quinolones. Now for the mechanism of action, I'm going to really tell you something about cell replication. Now look at something here. In replication, let me say this is the nucleus here, and this is the DNA strand that we want to replicate. Now in replication, I bring the DNA strand outside like this. Okay, now if I use the enzyme called helicase, what helicase will do actually is that it is going to unwind some portions like this. So some portions will go like this, and like this. Now, what happens that we see is that, let me really show you. Now, remember, we are unwinding as we go in this direction. So as we keep unwinding, you get to see that they are going to be so stuck together. So stuck together. All right. Now, that stuck together is what we call a supercoil. A supercoil. And this can have adverse effect on replication. It can halt replication. So the body now brings in a second enzyme that we can either have DNA gyrase or what we call DNA topoisomerase 4. Gyrase is also called isomerase 2. Topoisomerase is also called 4. Now watch what happens actually at this point. What do these particular enzymes do? They have an action to remove supercoils. So how do they do that? They are going to cut some portions like this. Now if you have something like this that draws so fast like this, now what it will do is that it will cut a portion upwards and cut a portion downwards. So we have something like this now and another portion, then it will join the other portion and take this portion, just like they were still joined together, but it tries to unwind it. So it cuts one portion, cuts another portion, and brings together. The name of that work is nicking. It nicks one strand and then nicks another and seals. Nicks, seals, nicks, seals, so that it can, the subsequent strands appear originally how they were, and it makes helicase keeps doing that unwinding as it goes forward. So mechanism of action, I've said, inhibiting which two enzymes? It will be inhibiting the two enzymes, either DNA gyrase or DNA topoisomerase, depending if it's gram positive or gram negative. And when that happens, we cannot remove supercoil, and this is going to hold our replication. And when it happens, what are the effects that we are going to see? There is going to be disruption of cell division, or we can even have failure of cell division, or at the end of the day, it could even cause cell lysis. These are things you should remember. These are things to consider. Cell division disrupted, failure of cell division, or even cell lysis. But remember, when you get off quinolone, mechanism of action that must be in your mind: DNA gyrase, and which is also called topoisomerase 2, or the DNA topoisomerase 4. All right. Now, for the resistance happens to be almost the same for all antibiotics. Either the amount that enters through this channel like this, we reduce it. So we say increase in influx. That's number one. Or either the amount that entered, all of them are being pumped out. We say increase in efflux. If a bacteria does that, it is trying to destroy it. Or another way again is that we can alter enzyme target. Yes. By alter enzyme target, maybe the enzymes that are needed for this process may be changed, making quinolone useless, because it cannot, even if there's a new enzyme, these DNA gyrase and DNA topoisomerase were what quinolones were made for. So they won't have any action. And then lastly, we can also even alter altered quinolone binding sites. So the sites where quinolone would have bounded there, we are also going to do that. And even sometimes even some point mutations. Some point mutations at any of these point mutations, probably in the enzyme, point mutations either in the quinolone binding site and all of that. So increase in efflux, pump it out. It doesn't have any action to eventually reach the site of action. Or decrease in influx or altered enzyme target, altered quinolone binding site, and point mutation. Now, what about the uses of quinolone? For the uses of quinolone, maybe I'm going to remove these. Okay. Now, use of quinolone, I'm going to have here P squared that stands for it has been useful for prostatitis. It has also been useful for pneumonia. All right. It has also found usefulness in GIT. A good example is enteric fever. Enteric fever that is caused by either the Campylobacter jejuni, the Helicobacter pylori, all of that, but enteric fever. And also the second G for the gonorrhea infection. All right. Now, we also have, it has a function here, CQ. Chancroid is a sexually transmitted kind of infection. Conjunctivitis, okay, and then inflammation of the bladder called cystitis. All right, then S for skin and soft tissue infection. Skin and soft tissue infection. T here for TB as a second line. Please remember, first line for TB were the RIPES. These are the first lines for TB, first line. And RIPE stands for rifampicin, isoniazid, pyrizinamide, ethambutol, and streptomycin. All right, so please, the T here stands for TB, but it's a second line because these are first line, which I just felt I needed to tell you for the sake of your next exam coming up. Now, E here reminds me of epididymitis. That's inflammation of the epididymis, epididymitis. RO reminds me of respiratory tract infection. And then M reminds of meningitis. All right, so this is the usefulness of our quinolones. 2, 4, plus 3, 7, 8, 9, 10, 11, 12. So 12 functions at most you should know for your next exam. What are the adverse effects of quinolones? Adverse effects of quinolones. Now I'm going to be talking the adverse effects on different body parts. Now, the adverse effect number 1, on the CNS, it is going to inhibit GABA. It inhibits GABA. So by inhibiting GABA, we're going to have CNS symptoms like dizziness, headache. Okay. It also have some functions on the GIT. On the GIT, it will cause nausea, it will cause vomiting, it will cause diarrhea. Okay, has some functions on the CVS. It will cause prolongation of QT interval. Now, another important MCQ question was mentioned here, the MGS. That is 7, this is 10, this is 15. That means citalfloxacin will take about 15, the prolongation 15, the gemiflux about 10, and then the moxiflux about 7. All right. Now, photosensitivity is another one. Photosensitivity, and it has also been linked to things like second degree burns, etc., especially when they are exposed to UV light. All right. Okay, so we have mentioned some of the major ones for the adverse effect. Now, what about the drug interactions? And we end the picture here. Now, for the drug interactions for our quinolones, it can interact with NSAIDs. Now, by NSAIDs, what will NSAIDs do? It will improve its CNS effect. CNS effects are still being shown here. Things like the effect on the CNS, GABA, being inhibited, dizziness, headache, fatigue, and what have you. Now, it can also act on things like it can have some reaction with warfarin, theophylline for asthma, and also its action on caffeine. Now, what happens? Their plasma concentration are going to be increased whenever they are given alongside ciprofloxacin. That's quite necessary. You appreciate. Okay. All right. So with this, we have been able to have a wonderful journey in quinolones. I've been able to take you through that journey using this outline and highlighting some of the major things. Kindly like this video, kindly share this video, kindly add a comment section there, and then kindly give a feedback. That way it helps YouTube to recommend these videos to others who might find this video helpful. All right, until then, see you next time. Thank you. Bye.